my specialist area is complex surgeries, and one of the surgeries that helps prevent preterm delivery is the cervical cerclage. So mothers may come in with previous preterm delivery or mid-trimester loss, we say when they've had a miscarriage around 20 to 24 weeks or even 18 weeks. And these mothers are followed up with cervical length measurements. And some of them, if they've had multiple miscarriages, then we may have to do what we call a cervical cerclage, where we put a stitch around the cervix. So that pressure of the pregnancy is not shortening the cervix and making them go on to have a miscarriage. That is one of my specialist areas. The other complex surgeries could involve where the placenta is at the lower part of the uterus, covering the neck of the womb, which means they need a cesarean section for delivery. But the placenta being very low itself can cause a lot of bleeding during if they were to labor, and that's an impossible situation. You can't labor the placenta previa, is what it's called. So you need a cesarean section, and obviously a private obstetrician or a senior clinician is able to minimize the blood loss, which would happen in these conditions as well. The other conditions that I'm mainly asked to operate on are women who've had previous fibroid surgeries or currently have large fibroids in the uterus. Again, this is a condition where there can be excessive blood loss. And so having a senior clinician who will perform these surgeries hundreds of times actually leads to a better outcome, because we are used to operating in these sort of situations within the uterus.